Calgarians don't take a back seat when it comes to health care. Our city is known for its best care anywhere. Tonight, you'll explore the new frontiers in medicine as we take a probing look at back pain, what causes it, why so many people suffer from it, and how to get the back in shape. Go inside the body with medicine's most advanced scanning devices. Imaging is the new process that takes much of the guesswork out of diagnosing and complements the existing X-ray technology. Man and machine are the new medical team. Enter the high-tech world of a modern hospital laboratory where computers offer valuable time-saving assistance to medical personnel. Meet John Kinsey, a victim of chronic pain. Find out what effect constant pain has had on his life and relationships and how he's found relief from a very different kind of clinic. Experience the problems of a high-risk premature birth and see how the specially trained neonatal staff give life-sustaining support to babies who are born too soon. New technology, new treatments, and care that's second to none. It's all part of the best care anywhere. Welcome to Best Care Anywhere. I'm Kirsti McLellan. Nothing stirs our emotions quite like the sight of a newborn child. Of all the wards in the hospital, the maternity ward with its attendant nursery full of newborns is probably everyone's favorite. It's a place of life and beginnings. But for some babies, life comes too soon. The drama surrounding a premature birth enfolds not only the infant and its parents, but a specially trained medical team. While there's no substitute for the comfort and safety of a mother's womb, medical technology can intervene to save the lives of premature babies. With round-the-clock care in the first-rate facilities of Calgary's Foothills Hospital, preemie babies have a better chance of growing up healthy than ever before. You're looking at modern medical technology sustaining the life of a baby that was born 3 months premature. Possibly, the most important moments of our lives are the very first.
Linebacker for the Stampeders.
Not everyone's entry into the world is this smooth, although I'm sure baby Zane, a 9-pound, 8-ounce cesarean birth, probably wouldn't agree. A premature infant is twice as likely to be delivered by cesarean as a full-term baby. Today, the care of newborns, particularly preterm babies, is one of the most sophisticated and rapidly advancing fields of medicine. Dr. Doug McMillan of the Foothills Hospital's neonatal unit is in the business of keeping babies alive.
Well, this little boy's name is Sean. Like many small babies who are born early, their lungs are immature and they have difficulty in breathing, and they develop a condition known as hyaline membrane disease. We have a tube which goes in through his mouth and into his windpipe, and then it's hooked up to a machine here which provides him oxygen and actually helps the baby breathe.
Being born too soon presents a host of problems, the most common of these being respiratory in nature, stemming from the baby's underdeveloped lungs.
Premature babies are very prone to have episodes where they forget to breathe. In this case, the baby is on a respirator, so we're breathing for the baby, but other premature babies would have periods of, as they're called, apnea, where they cease to breathe for varying periods of time. However, when the alarms ring, the nurses come over and tickle the baby's tummy or provide some stimulation, and usually the babies get going again.
The sights and sounds of the neonatal intensive care unit are strikingly similar to those in a toy department at Christmas. Monitors are continually honking and beeping, and brightly colored plastic tubes are everywhere, each leading to a tiny child. A preterm baby can weigh as little as 500 grams and fit comfortably into an adult's hand. Size alone, however, does not determine the special care and attention a preemie will need. Baby Michael John was born at the Calgary General Hospital, but because of his respiratory problems, had to be brought to the Foothills, which is the referral center for Southern Alberta and parts of BC. For the special job of transporting babies safely, there are special people.
We have 4 people on our transport team. 2 of them are trained specially for transports, and that's a transport nurse and a respiratory technologist. And the 2 paramedics go along with them to help them with the equipment and for driving and stabilizing if they need any help. The primary responsibility is to the patient is to stabilize our little neonate. And they try and do that at the hospital in which the neonate was delivered. Once the neonate is stable, then they come in the mobile unit and bring the stable neonate to the Foothills Intensive Care Nursery to be cared for further. Sometimes we go along ourselves if the baby is extremely sick. Till about a year ago, we used to go on all the transports ourselves. But now that we have these specially trained nurses and respiratory technologists, they go out and do most of the transports on their own.
Taking care of these babies is a round-the-clock job. That, along with the vast amount of equipment required, makes neonatal care an expensive proposition. Head nurse Mary Marchand explains what it takes to keep things running.
Right now we have, for 42 baby capacity, we have 84 full-time nurses and about 31 casual part-time staff. And then there are the respiratory technologists who come and do the blood gases 24 hours. There are the lab people, radiology, many departments feed into this. So there are an awful lot of people.
Come on, sweetiekins. Let's just come right up here. Oh, my goodness sakes. Well, sweetie, that's not a very good picture.
Ev Erickson has been volunteering her services in the nursery for the past 4 years. Medical care isn't the only thing babies need. They also need the human touch, which is provided by people known as cuddlers.
Oh, well, I just love it. I really do. I'm quite used to babies, and I've always just loved being with them and holding them and so on. I just come in and hold them or tend to them, do whatever needs. Sometimes I feed them and just put in time with them so they have a little variety in their day.
Although most media attention seems to focus on the doctors, the contributions made by nursing staff and volunteers are vitally important, as in the case of hyperbilirubinemia, or more commonly, jaundice.
25 years ago, a group of nurses in Britain noticed that the babies closest to the window were less jaundiced than the ones at the far side of the room. And now we know there's a property of light. This baby is under a light here that helps break down that bilirubin pigment as it circulates near the skin. And the mask on the eyes, which you can see the nursing staff have actually drawn closed eyes on, is really to protect the eyes.
Because most preterm babies require some form of life support, breastfeeding isn't always possible. Jennifer is about ready to go home. She's being fed a formula called Enfalac, but initially, preemies are given about a teaspoon of mother's milk an hour. So city hospitals have set up a mother's milk bank because mother's milk is best.
Well, mother's milk is specific to the needs that small babies have. It's the right composition of fats, carbohydrates, proteins. Sometimes we need extra vitamin and mineral supplementation, but it is just a very good product for these babies.
Babies can be fed intravenously or by the method shown here, known as gavage. The container of milk is suspended above the baby so that gravity can slowly pull it down and into the baby's stomach. The Mother's Milk Bank program was initiated by the Junior League of Calgary. It requires the time and effort of a single staff member plus many volunteers.
To pasteurize the milk, we need 6 volunteers, which are provided by the hospital. And then for picking up in the community, we need 20 to 30 volunteers at any given time.
This is baby Angela Ingram. Only 4 weeks old, she was not due for another 2 months. Since her birth, she's already undergone 2 major operations. Although her parents, Dixie and Kevin, have come from Innisfil each weekend to see her, this is their first chance to hold her.
I've wanted to hold her. You know, I've seen other mothers in here holding their babies, and it's something that I've wanted to do, so it is great.
Everybody in here has been more than kind, you know, really good. I admire the kind of work they do because they're just working with, well, look at the size of her. It's so small.
She's slowly but surely
We'll have her home by
coming.
Christmas, we know that.
Yeah.
Each infant is assigned a primary nurse who follows their progress through until discharge. Because the nurses work so closely for so long with the parents and child, they can't help but develop strong attachments. It's an emotionally charged situation.
You become more emotionally attached to the baby and to the parents. It's not, of course, just baby care that we have here. It's a whole family, and that's so very important.
10 short years ago, baby Angela's chances for survival would have been slim. Without recent advances in medical technology, she would not be on the respirator she now depends upon to live. Both Dixie and Kevin are proud of Angela's determination and think of her as a real fighter. For Father Kevin, holding her for the first time is the first step in taking her home.
There you go, sport. Now you're home.
There we go.
There's the stuff. Look at that.
As you can see, the neonatal intensive care unit requires highly specialized technology in its treatment of preterm babies, right down to the analysis of a baby-sized blood sample. Technology is smoothing the way for many departments of Foothills Hospital, especially the laboratories. In a moment, you'll see these high-tech changes in the medical lab and probe the traumatizing effects of chronic pain. Like everything else these days, healthcare is rushing headfirst into the computer age. Nowhere is this more evident than behind the scenes in the hospital laboratories. The general chemistry lab here at Foothills Hospital has evolved into a state-of-the-art computer complex. In fact, the services offered here are so extensive, it's become the referral center for all of Southern Alberta. This means that even residents of small towns can be assured of the most advanced diagnostic and treatment services. We've come a long way from the days when everything was done with a microscope. Although this may conjure up images of a space-age automated assembly line, it's actually part of the workings of a modern hospital laboratory. As in most other businesses, computers have become a dominant workforce in medicine. There are, however, some functions that computers can't carry out, and blood collection is one of them. As a patient, this is the only part of the testing process you're likely to experience. After a blood sample is taken manually, automation takes over in the lab. Medicine can derive a great deal of information from just a little of your blood in the shortest possible time. A far more efficient process than manual testing, which was often slow and laborious.
At the very beginning, before we had automation in the laboratory, a technologist would take a series of test tubes and pipette or dispense into the test tubes a measured quantity of reagent and then add the patient's sample, perhaps another reagent, and leave the test tube to stand for a given period of time so that this color would develop. And then take the test tube and manually read the color density in another instrument. And that's, of course, very labor-intensive and often quite slow. It has the added disadvantage that under pressing circumstances where there's a very high workload, the technologist is subject to human fatigue and the procedure is not as efficient as it might be. And the latest development, of course, is a totally automated procedure where the patient's sample is given to the machine, as it were, in a little cup. And the machine does the whole procedure. It samples from that cup, carries out the chemistry, makes the calculations, and presents the laboratory with a final completed result.
There are several blood testing machines in use in the general chemistry department of Foothills Hospital. Sounding like characters out of Star Wars, the DuPont Automated Clinical Analyzer and the IL-508 are two of these units, which are prized for their ability to rapidly perform tests and print out the results in a matter of seconds. For a more complete analysis, there's the imposing SMAC 2, capable of performing up to 20 tests on 150 samples per hour. The machine reads and records test results for the interpretation of the technologist. Results from a single sample used to take up to 2 days when the blood was tested manually, but even with this high-speed, sophisticated technology, no process can be 100% accurate all the time. So there are backup systems, such as the RA1000.
For example, if I run 20 tests on this instrument, there's a good possibility that 1 or 2 of those tests won't work. They won't pass the standards, the control standards. For example, if a reagent stopped drawing, then that test is no good. So what I would do is take that sample and put it on the RA1000, run it, and it is hooked up to SMAC. There's a computer link, and it will actually plug the values in that it received on the RA1000 into the profile being done on SMAC2.
For special cases, there's special technology. Preterm babies require dozens of tests, but can't afford to give an adult-sized blood sample. For testing on an infant-sized sample, shown on your left, there's a separate department known as microchemistry. One of their most innovative instruments is the Kodak Ectochem.
Well, the Ectochem is an automated analyzer which takes samples from patients and performs various relatively straightforward chemical tests by a rather novel thin film technique. Kodak, the manufacturer of the Ectochem, has developed a series of thin plates on which we drop the patient's serum, and this serum diffuses through the plate and develops a certain color reaction. And the instrument measures the color reaction and equates the intensity of color with the concentration of that particular substance in the patient's blood.
The results from each of these sophisticated machines can be sent instantly to computer terminals located at each nursing station throughout the hospital. This makes it possible for a patient's blood condition to be at the fingertips of the medical staff. The initial cost of high technology is high indeed, over $500,000 for the SMAC-2 alone. But in the world of healthcare, where life and death remain the bottom line, value is seldom measured in dollars and cents.
Cost efficiency is a very difficult thing to determine in medicine. And I think perhaps it's better explained by saying that by automating, we've been able to save staff time and divert them to other tasks, and so offer the community a far wider range of tests than they would be able to get if we didn't automate.
It's clear the latest developments in automated lab equipment have provided patients in southern Alberta with better quality, reduced costs, and faster delivery of their test results. It all adds up to better care. The laboratory isn't the only department which has turned to new technology. Coming up next, you'll go inside the body for exciting new developments in imaging, and you'll discover the causes and cures for the most common of complaints, back pain. We're all familiar with X-rays. Hardly anyone has escaped childhood without a fracture or injury requiring a trip to the radiology department. But the science of looking inside the body is changing. Besides some of the latest developments, such as the CAT scan, the X-ray looks as dated as a gramophone beside a high-tech stereo system. Even the language has changed. Radiology has been replaced by imaging as a means of looking inside the body. Anyone who's ever had a nasty fall down the stairs or turned an ankle while skiing will find this experience all too familiar. As a matter of fact, the standard X-ray has been a mainstay of the diagnostic process since the turn of the century. In the last 10 years, however, radiology departments have seen a dramatic increase in new technology and techniques designed to give a physician a better look at what's going on inside the body. Diagnostic procedures have been expanded and transformed to such a degree that even the name of the responsible department has become obsolete. Departments of radiology are now departments of medical imaging. At Calgary's Foothills Hospital, we're seeing the beginning of a medical revolution. The X-ray as we know it, though still very useful, has its limitations. Today's doctor has a wide range of other low-risk diagnostic tools at his fingertips. Possibly the best known of these is ultrasound, a non-invasive method used extensively in gynecology, obstetrics, and general procedures.
Basically, what we're doing with our transducers is introducing a sound wave into the body. The sound wave will travel through the tissues, it'll strike the internal structures inside the body, and then bounce back to the transducer. When the sound reaches back to the transducer, it's transmitted onto a screen, much like what we're looking at here. It's basically akin to yelling in a canyon, and when you yell down the canyon, you wait for the echo to come back to your ear.
The principle behind ultrasound examinations isn't new. In fact, it was demonstrated over 100 years ago, but wasn't applied medically until about 1950. Even then, the technology was in its infant stages, as patients had to be immersed in a water bath during the procedure. The modern high-resolution pictures provided by ultrasound allow doctors to view organs and soft tissue without the need for radiation exposure, which makes it ideal for pregnant women.
Here, the advantage is that when you put the transducer on the pregnant abdomen, you can see where the fetus is floating around in its amniotic fluid, and you can see the position of the placenta. And we will put our needle into the fluid away from the baby and away from the placenta. And so there's great advantages of doing amniocenteses that way. Prior to the advent of ultrasound, the amniocenteses were essentially done blind.
Ultrasound is the most widespread of the new imaging methods. In the development and use of new techniques, there's always one primary concern: the patient's safety.
Ultrasound is very safe at the frequencies we use. There is no known side effects to the ultrasound. As you know, we use it a lot in obstetrical work, looking at fetuses, and to date there's been no proven or documented side effects to the kind of frequency we use.
Different methods produce information that is in many ways similar. The choice depends not only on the clinical problem, but also on the availability of the equipment. One of the busiest machines in the province is the computed axial tomography scanner, the CAT scan.
There's actually been a lot of changes in the technology in the CAT scanners. The first CAT scanner that we used in the department was a head scanner, and that one we purchased for approximately $350,000. Now, with today's technology, they no longer build them as head scanners. They're now whole body scanners, and they range in price from $1 million to $1,500,000.
The new technology is complex and very expensive, but there's no question that the information it provides makes it invaluable to the doctor.
When you take an ordinary X-ray, you get the film basically is in front or behind the patient, and the X-ray is coming through, so you get a recorded image in one plane. Well, with the CAT scan, the images are cross-sectional images taken through the body, so that we're able to look in a third dimension, in essence, compared to what we were before. And areas like neurology and neurosurgery, it's given us direct evidence of traumatic lesions, tumors, etc., within the skull that we really had no direct way of visualizing prior to the introduction of CAT scan.
The scanner, its computers and controls take up 2 large rooms and can be an overwhelming sight, especially for the patient.
Most of the people haven't had one of the examinations before. We explain our procedure, what we're going to do, and let them know that we're monitoring them at all times, and if they do have problems, all they have to do is call out to us or indicate to us that they'd like some assistance.
In this hospital, we are seeing approximately 30 patients a day for scanning, and well over 2/3 of those are still people with head problems and intracranial problems. But now it is available, and the techniques have been developed to look at almost any organ within the body.
Take a breath in, blow it out, stop breathing.
I experienced a CAT scan procedure the way most patients would, with one major exception. I wasn't exposed to the X-rays, although the dosage in a standard scan isn't considered a hazard.
We have within the department, as most large departments do, a very elaborate setup as far as safeguarding the patients and the personnel within the department. The hospital employs a full-time physicist and 2 assistants whose sole job is really safety and radiation protection, and so that all of the equipment is checked by our own people on a very regular basis.
Although the machinery itself is very complex, its benefits can be explained much more simply. It gives the doctor a better look at what's going on.
Now, there's a big difference between these 2 kidneys. This one is a normal-looking kidney. This one over here has got a big bulge going out on the lateral border of this kidney. The patient's now had some contrast material, and we repeated the examination, and we can see this mass now again showing up clearly here. This mass now we can say is a very vascular mass, and this is a bad sign in that this is a cancer of the kidney.
High costs and rapid advancements throughout the field of medical imaging have created an entirely new set of problems for hospitals. They are trying to provide the best health care available in a field that's moving ahead faster than ever before.
Well, of course, this is one of the biggest problems that we face as radiologists and administrators today, is that none of these methods are cheap. They're all very expensive, and their lifespan is not long in terms of what we've grown accustomed to think of. Well, of course, the concern is in anything that you buy, it's all very, very expensive. The developments are very rapid. They're very exciting, that's true, but the technology is changing so fast that you're afraid really that whatever you buy will almost be outdated by the time you get it installed.
One of the newest developments in the imaging department in the Foothills Hospital is a computerized image networking system. It allows for the almost instant transference of these CAT scan results to a viewing console several floors away. It's just another step forward that keeps Calgarians on the leading edge of healthcare. As fast as the technology changes, so do the treatments. In a moment, find out new ways to cure pain in the back and how people cope with the trauma of chronic pain. Many people take a healthy back for granted until something goes wrong. From your neck down, every inch of your back is susceptible to stress, abuse, and pain, often caused by everyday living. The trouble is, back problems have a multitude of causes, and for each cause, there are a number of different treatments, such as hydrotherapy. Although there are many other ways to treat a bad back, there's no easy way out for the sufferer of back pain.
To the thoracolumbar region, to the right.
Next to headaches, back pain is the most common physical complaint in the world.
There's not
When
quite-
doctors speak of the back, they usually mean the spinal column. It consists of 24 interlocking bones called vertebrae. The top 7 are the cervical, the next 12 are the thoracic, and the lower 5 are the lumbar vertebrae, where most pain occurs. Our backs were never made to withstand the kind of punishment we give them. These people, however, aren't the only ones who run the risk of serious back problems. Just sitting at a desk, wearing heels, bending over, or even reflex actions such as coughing or sneezing can knock the back out of whack.
Now, we'll all come up a couple of steps again. We'll do the 2 ones.
The road to recovery from a serious back problem can mean many hours in physiotherapy. Because there are so many different causes, there are dozens of different cures. In fact, at least 8 out of 10 of you have back problems. When a body that has spent most of its time in front of a television is asked to perform strenuous physical labor, it has to know how. What feels good is not always right. These British training films save hours of time lost on the job by teaching proper lifting, bending, and stretching techniques. If you feel back pain, it doesn't always mean a serious injury. Dr. Gary Hughes is an orthopedic surgeon, and he sees back problems every day.
However, by far, in a way, the majority of people that come into an orthopedic surgeon's office with back pain is the garden variety of back pain that's either due to mild overuse or muscular backache that usually will clear up on its own with symptomatic treatment and require no specific further investigation and or surgical treatment. Symptomatic treatment we take to mean the conservative measures of resting the back, using heat, slowly mobilizing the back, and this usually needs the help of a physiotherapist or physical therapy department. Analgesics or muscle relaxants as medication may also be used along with the physical therapy.
Physiotherapy takes many forms. There's traction, which dates back to Hippocrates and relieves the problems by opening spaces between the vertebrae. Exercise is the most common form of treatment and is important in prevention as well. Unfortunately, people tend to slack off when their backs feel good again. Applying heat provides symptomatic relief. It's been recommended for years by physicians and grandmothers. Ultrasound creates a heating effect in the tissues through vibration. It also increases the circulation. Electrical stimulation can decrease the body's perception of pain. From it, the body gets input, whereas biofeedback registers the body's output. Biofeedback reads body function and passes the information on to the patient through the machine. Then the patient can willfully relax muscles for relief.
One of the pillows should go right underneath your shoulders.
Occupational therapists are concerned with giving people back maximum function and making sure problems don't reoccur. The way you sleep, for example, can be an invitation to backache.
When you lie on your back, you try to put 2 pillows underneath your head, one right underneath your shoulders, the other one under your head. Make sure you don't put both under your head because you will arch. And the other one important part is to bend your knees, put a pillow or rolled up sleeping bag underneath your knees, and then have your feet supported by the mattress. You would want a firm mattress, and there are quite a number of different ones available. Some people like to sleep in a waterbed, and we often have requests if that's good or not. And usually we recommend that when they have acute back pain that they do not go in the waterbed because it's very difficult to get in and out.
Even the kind of shoes you wear or the chair you sit in can be a potential back hazard. If you're on your feet all day, high heels are not recommended.
Make sure they're flat shoes and give you a wide base of support. Because if you have high heels, what happens is your center of gravity is off and you have to try to balance and use your back muscles as well as your calf muscles. The most important part is to have a chair with a good firm backrest and armrests so that your arms are supported. Basically what you try to do is have your weight supported by your legs and your arms rather than by your back. So when you put your arms on the armrest, you have the upper part of your body supported. And when you put a footstool underneath your feet, which brings up your knees a little bit higher than your hip, and that will help you to put the weight through the legs rather than your back.
These uniquely shaped chairs are designed specifically to take the pressure off your back. They keep the back at a natural angle by shifting the pressure from the spine to the buttocks and legs. Niels Ostergaard sells these imported chairs to Calgarians with back troubles and those who want to avoid back troubles. The price tag ranges anywhere from $150 to $500.
But I would rather look at it as a kind of an investment. I mean, you only have one back. You cannot get it repaired.
Mr. Wan Lee practices the ancient science of Korean hand acupuncture. Treatment is done on the hand only, with smaller needles than those used in body acupuncture. This patient, Mr. McDonald, came in with a common complaint, lower lumbar pain. According to Mr. Lee, the pain was caused by excess energy in the patient's large intestine. He says there are 344 points in the hand, which each correspond to organs in the body. Mr. Lee believes acupuncture merely enhances the natural healing force in the body, and his patient agrees.
I was having trouble with my lower spine, and I decided to try acupuncture. I've been to a few doctors. They offered medication, and I'm not too fond of drugs, so I took this route instead. I'm quite happy with it. I work in construction. It's the difference between night and day.
Even the always skeptical medical community doesn't deny its effectiveness in some cases. Chiropractic is a conservative approach to back problems. Unlike the acupuncturist, the chiropractor has a clear idea as to the principles which make the treatments work.
The basic premise is that structure governs function, and that the structure, primarily that of the spine, will affect the functional integrity of the nervous system. The nervous system controls and coordinates all the organs and structures in the body. Chiropractic principally works on the joints or the vertebra in the spine. This patient's problem is at the 7th thoracic level, and the vertebra has twisted towards the right side.
Most often, chiropractors advise manipulation of the vertebra. In this instance, Dr. Peterson is applying quick, sharp pressure with the heel of his hand to realign a vertebrae that has gone out of place. After adjustments like this, most patients say they feel better. While some people swear by their chiropractors, some members of the medical community are less than enthusiastic.
By and large, the idea that the spine is, quote, out of place, unquote, has no real scientific basis in fact.
But when traditional treatment was unsuccessful for Canadian skier Steve Podborski after a serious injury, it was a chiropractor who helped him back on the road to recovery and to an eventual World Cup downhill title. Of all the operative methods, chemodiscolysis is one of the most controversial. Dr. Francis LeBlanc, chief neurosurgeon here at the Foothills Hospital, has been performing this procedure in Calgary for the last 10 years.
Chemodiscolysis is a technique that we use to modify the nature of disc tissue. When discs herniate or bulge, they tend to squish out of position. So we can now put a needle into the disc space under X-ray control and inject an enzyme into the disc, which, if proven to be a bulging disc, will cause that disc to shrink or dry out and remove the pressure of the protruding disc from the irritated nerve root nearby. 72% of the patients who have this procedure as a treatment of sciatica are pain-free and back to their full activities in 30 days. And most people who have sciatica from a bulging disc will respond to physical therapy or chiropractic manipulation or swimming exercises or any other form of conservative management. 75% of such patients will have their sciatica resolve and their disc settle down from bulging and irritating a nerve root.
Although there is a lot of controversy surrounding this procedure and the injected enzyme chemopapain, Dr. LeBlanc believes most of this concern is unwarranted.
The risks to this procedure are minimal indeed. In over 600 cases, we've only had one significant reaction to the enzyme, and that's the only known risk of the procedure, is a sensitivity reaction to the enzyme. If that should occur, even in 1 in 600 people, it's easily treated because there's an anesthetist in attendance who has an intravenous route in operation, and the specific medication can be given to reverse any reaction very quickly.
The entire operation took just 15 minutes with only an ordinary Band-Aid for dressing, and the patient was alert enough to smile for our camera. Chemodiscolysis, however, is not the answer for 3 out of 4 people who need surgery. Most people still require disc removal, spinal fusion, or a combination of the two. There is no one cure-all for back pain, but one thing is clear. If you take care of your back, it'll take care of you. The return to a strong, healthy back may require much work. After experiencing back pain, sufferers agree. It pays to keep the back in line. But what about the kind of pain that never goes away? In a moment, you'll meet people who live with chronic pain and the measures they must take to cope with daily suffering. Despite continuing advances in medical knowledge, pain remains a subject that's shrouded in mystery. Doctors spend years learning to treat illness and disease. Yet there's very little emphasis on the study and treatment of pain, even less on the psychological effects of long-term suffering. Medication is effective in treating most types of pain, but for some individuals, even the most powerful drugs aren't enough. These are the people who face a lifetime of pain and cope each day with its debilitating effects.
You should take better care of your teeth. You have quite a cavity here. Is it safe? Look, I tell you, I can't.
Pain. It's the stuff nightmares are made of. Yet at some point in our lives, each and every one of us suffers pain. In fact, life begins with pain, and often it ends that way. Pain is classified in 2 different categories, acute and chronic. Childbirth is an example of acute pain. Dr. Leo Strunen, head of the Department of Anesthesiology at the Foothills Hospital, explains.
Acute pain is usually described as something which has a short duration, which is related to a specific incident, say an injury or an operation, and where the cause is clear and it's short-lasting. Now, chronic pain, on the other hand, is something which lasts for a long time, where the original cause may be lost or not clear anymore, and where the pain itself may be interfering with the patient's way of life. And it's usually associated with long-term diseases, patients with cancer, patients who have chronic conditions, backache and arthritis and so on.
During an operation like this one, the surgical team can control the pain. But the medical community has yet to come up with a surefire way to measure it.
You draw a horizontal line with a little anchor at each end, and you say to the patient, the left-hand end represents no pain, the right-hand end is the worst pain that you can imagine. And we want you to put a mark on there where you think your pain resides. It's very crude.
At this birth, the mother felt no pain at all. In this case, as in many others, the pain was controlled by what's known as an epidural block.
It's a method of pain relief whereby a needle is introduced into the small of the back and a small catheter is placed in a small space outside the spinal canal. A local anesthetic is introduced into this space and bathes the nerves as they come out of the spinal cord and just blocks any pain. I feel that the age of pain during labor is over. I feel that a woman shouldn't have to suffer during labor, and we have a very effective and safe method of pain relief, and I feel it should be offered to any woman who comes into the hospital.
Eventually, epidural blocks will be used to control pain before, during, and after other operations.
If we use an epidural technique, we can supply an infusion of the drug with a pump at a constant speed, and therefore the patient can be pain-free continuously, and then go back to the ward with that in, give them the right drugs, and go on with that pain relief as long as they need it. My guess is that within the next 6 months to a year, we'll have sufficient information that we can, for patients particularly having major surgery, provide them with pain relief on a continuous basis using epidurals.
On her wedding day 11 years ago, Brenda Oman had a bright future ahead of her. 2 months later, she was told she had Crohn's disease, which required a series of major operations. She's also developed arthritis. With her husband Gail's support, she copes on a daily basis with the excruciating pain and the changes it brought to her life.
Well, I was able to work 11 years ago, and I was quite active. You know, we used to like to go to football games and get out. We used to go out quite a bit, like swimming and things like that, where I can't do that now. When my sickness was real bad, I was hospitalized months at a time, where, you know, I would live in a hospital and my family would have to come here for an hour a day, and that was it. Where now I can pretty well do it all at home. It's made quite a bit of difference. I'm able to stay at home and have my pain controlled at home. And whereas one time I used to have to come into the hospital and be here for the control. And as I say, I would be taking up a bed all day just for pain control every few hours.
Brenda is now a patient at Foothills Hospital's pain clinic, a new and valuable concept for those in constant pain. Dr. Ian Clark is the main force behind the clinic.
We offer management of drugs, and in fact, probably in the majority of patients, drugs will be part of their treatment. We offer a variety of physical treatments, but I ought to say that physical treatment is a relatively small part. That would include nerve blocks, perhaps certain kinds of surgery, perhaps certain kinds of stimulation, such as electrical nerve stimulation or acupuncture. And in addition, we offer a variety of psychological management techniques, which includes biofeedback and hypnosis, and hopefully in the near future, a variety of behavior therapy, as well as simple psychotherapy for the many psychological problems the patients have consequent to their pain.
Dr. Clark firmly believes there's long been a need for a separate program just to manage pain.
Well, I think basically because most doctors assume they know how to manage it, and yet in fact if you look at the curriculum of medical schools round the world, most doctors have about 1 to 2 hours in their entire undergraduate medical course learning how to manage pain, and most of that is learning how to manage acute pain and not chronic pain, which is a vastly more complex problem. This is continued into their postgraduate career, so that although most doctors spend a lot of their time, their spare time, keeping up to date on advances in medicine, pain is hardly ever one of them.
Before she came to the pain clinic, Brenda spent a good part of her life in the hospital. The independence the pain clinic affords her means everything.
When I came to the pain clinic, I found that there's a lot more people like me that have these problems, and finding there's somebody here to help us.
This is John Kinsey, another person under the pain clinic's care. He feels his first marriage failed, and he lost his job as a result of the chronic pain he suffered after a back injury. Now, with the help of the pain clinic, he's beginning to put his life back together again. He's now remarried and sees Dr. Clark on a regular basis with his second wife, Anne-Marie, by his side.
Fortunately, our relationship has been really, really strong, and she stood beside me in the whole affair, and that really went a long way. And it was a lot to ask. You know, relationships are kind of an economic agreement where, you know, you both have to keep your end of the bargain or it doesn't work. And that's really difficult when you can't help out with all those everyday things like, you know, the vacuuming, the laundry, the dishes. Somebody has to do all those, and if it's all on one person, it's a very onerous burden, you know. It's, I'm sure it was difficult for her to carry in a lot of times. She was out of hope too, I think, till Ian Clark came in. You know, what he says means how active I can be. You know, If he weren't there, I'd be back to using the bed and watching the plants grow and have someone else do the work.
Chronic pain sufferers are often considered hypochondriacs. Pain, however, isn't always caused by a physical problem. Emotional, financial, and psychological factors can cause pain.
It's very common for patients to be told that you're imagining it, or the pain's all in your head, or whatever. Pain's never imaginary. It's always real, but not always because of a physical cause. So a significant number of the patients referred to the pain clinic with pain have pain due to non-physical illness. That doesn't mean the pain's not there. It means that an operation or an injection or a physical treatment is not the right treatment, because there's nothing physical to treat. Still means the pain's real, though.
Before he came to the pain clinic, John Kinsey says there were many days he wasn't always sure that life was worth living.
It's given me a whole new outlook on life. You know, I can get back into doing the things that I've done the rest of my life.
Brenda Oman thought the rest of her life would be spent in bed. But today she's doing something she hadn't thought possible. She's looking for a job. The value of the clinic to someone in constant pain can't be overestimated. Brenda Oman and John Kinsey's lives have been given new hope through it. Dr. Clark and his colleagues have made great strides in pain management. Through continued testings of drugs and techniques, people in constant pain are able to live almost normal lives. John Kinsey, for one, is grateful.
He allows me to go on with my profession, to pursue, you know, my life, to enjoy my wife, my animals, you know, all of those things which are so taken for granted by everybody else, you know. Excuse me.
So much has been done in recent years to improve our health care, not just in pure research of diseases, but in the development of medical technology, more comprehensive care, as in the neonatal unit, and a better understanding of patients' needs, as in the treatment of pain. There's still much more work to be done, however, and as we near the 21st century, we can expect continuing progress in all areas of medicine and hospital care. Young and old alike, we're all entitled to the best medical care available. And with such exceptional facilities as the Foothills Hospital, generations of Albertans can look forward to the best care anywhere. I'm Kirsti McLellan. Thanks for joining us.